Thanks, Matt. So hi, everyone. Great to be here. Yeah, my name's Barr. I'm Professor in Public Health at the University of Liverpool. I'm going to be talking about just some of the highlights from research that the team at Lilac has been involved in. And we have all the members of the team there up on the screen. And this is really some highlights from work that we've been doing, that the team has been doing, focused on trying to understand what is the impact on health of spending and investment by local government. Move my slides on. Okay, there you go. So the School of Public Health Research is organised around these three programmes: the Children, Young People and Families programme, Places and Communities, and Public Mental Health. And we also have these cross-cutting themes. The work that I'm going to talk about is really a collaboration, particularly between the Places and Communities programme and Children and Young People. So I'm sure many of you will be aware that there's been huge cuts in local government since 2010. By 2015, local government's budgets have been cut pretty well by 50%. And this was a response to the global economic crisis in 2008 and the subsequent austerity programme that was implemented by the UK government. So, but those cuts haven't been equal across different areas of service provided by local government. Some areas have been cut much more than others, and this just shows a table from Michael Marbot's recent report showing the cut in local government spending across different service areas. And the areas that have been cut the most are things like planning, housing, culture. Areas such as social care have been a bit more protected, but still have been cut. There's actually been an increase in spending on children's social care. But as we'll see in a minute, that is actually hiding some very important cuts in children's services. So what we look at is what effect has this had on public health? And what we'd expect from the sort of what we know about the social determinants of health, that many of these areas would have potentially large effects on health. But trying to understand the kind of causal relationship between those things is challenging. And one of the things that we use is looking at differences in how those cuts have happened, those cuts in spending have happened across different parts of the country, because they've been very unequal in the way those cuts have fallen. So this just shows gross expenditure, so total expenditure per head by local government across England, Scotland and Wales, broken down by area deprivation, so the level of disadvantage in different areas based on the indices of multiple deprivation. With the red line at the top is the most deprived areas in each country. And we see that they start off, more deprived areas have higher levels of spending, reflecting the higher levels of need in those places. In England in particular, the reduction in spending over that time has been much greater in the more deprived areas. We don't see that same differential across Scotland and Wales. The cuts have been much more equal across places based on their level of deprivation. When we look at specific areas of service, so this is looking at this cultural, environmental and planning services. So that's things like libraries and leisure centres, parks, those kind of things that local government are investing in. We see that those areas have been cut much more, but also the relationship with deprivation is even steeper, with them being cut particularly severely in the most deprived areas in England, that is. Again, we don't see quite the same pattern in Scotland and Wales in the relationship with the level of deprivation. And this is particularly important around with this group of services, because the government is currently proposing, is using the lack of relationship with deprivation in current funding, so the funding we see in 2017, as a justification for actually removing any relationship with deprivation and need from the formula that's used to allocate funding to places for these services. So if we look at children's services, we also see a similar pattern. Again, here the blue line at the top is the most deprived areas, and the red line at the bottom is the least deprived. And we see this is spending on Sure Start and early years services. And again, we see this has been cut by around 50%, and those cuts have been greatest in the most deprived areas. You'll remember from the slide earlier that there's actually been an increase in overall spending on services for children. So you might be wondering how that can be the case when there's been cuts in these preventative services. But that is entirely because at the same time there's been huge cuts in prevention, there's been a huge increase in spending on child protection and children being taken into care. So we have cuts in prevention happening at the same time as the consequences of not having preventative services increasing costs for local government. So what effect has this had on health? And we've got a number of different studies. Some of them are more advanced than others, but some of the early findings from those studies I'll just talk about briefly. We know in terms of life expectancy that life expectancy basically has pretty well stalled since 2010 to 2012, have been increasing fairly rapidly, and then those improvements have flattened off, and those more recent adverse trends have been worse in more deprived areas, and inequalities have tended to widen. And people have suggested, like Michael Marmot in his recent report, suggested that this increase in inequalities may well be related to these changes in local government funding that we've observed. But trying to look at the potential causal relationship between that and these outcomes can be quite difficult. One of the things we've initially looked at, and one of the issues with trying to understand those relationships, is that if need increases in an area, for example, if there are more people needing social care services, that increases the costs that local authorities have and their spending, but also increases risks from mortality or from people dying. So you can get what's sometimes called as reverse causality. So one of the ways that we try and overcome that is looking at changes in specific central government grants that won't be affected by these short-term fluctuations in need. And when we look at the main central government grants, we see that those places that have received the greatest cuts in these grants from central government have experienced the most adverse trends in life expectancy. And in the longitudinal analysis that we've carried out for that, we've shown that these cuts in the central government grants account for an additional around 10,000 additional deaths under 75 in England between 2013 and 2017. So it does look like some of these adverse effects on stalling life expectancy are potentially related to the reductions in local government budgets. A further study that we've got, led by my colleague Devara, is looking at the effect of cuts in spending on children's prevention services and increases in children being taken into care. And we find quite a strong relationship, particularly on prevention spend for teenage children, so cuts in kind of youth services, and we see that places that have had the largest cuts in those services have seen a consequent increase in teenagers being taken into care. For about every 10%, £10 reduction per child for those services, we see an increase in 2 children per 100,000, 2 teenagers per 100,000 being taken into care. So there does seem to be, as you might expect, that when you cut these prevention services, we are seeing an increase in the adverse consequences for children. Similarly, a study led by my colleague Kate Mason is looking at the effect on childhood obesity from cuts in Sure Start and early years services. And we see a small but significant effect with areas where early years services have been cut more, seeing a greater increase in childhood obesity. For every 10% cut in the spending on those early years services, we're seeing about 0.34% increase in childhood obesity. It's quite a small effect, but that accounts for about 5,000 additional children with obesity over the period since 2010. So, overall, we see across a number of services that the reduction in spending on those services does seem to be leading to some real consequences for public health, both amongst adults in terms of mortality, but also some of these important outcomes for children. And so, I mean, why is that important? I mean, it might be that it's kind of obvious that if you cut those services, there will be consequences, but it is clearly important that we demonstrate the impact of those decisions on public health, but also this research indicates the potential benefits of investment across these different service areas and can inform not just national decisions around investment in local government, but also decisions how specific local governments share out their budgets between service lines and which ones are the most beneficial in terms of public health for them to invest in. And finally, there is, at the moment, the local government finance is going through a major review. And at the moment, there is a real lack of appreciation amongst people working in local government finance of the outcomes that investment in local government can achieve in terms of public health. The government has just had a consultation. We've had a consultation in 2019 on how they assess need for local government funding, so how much each place would get according to its level of need. And for most of the service lines that we've been talking about, that consultation doesn't mention health at all as something that drives need for local government services, particularly around things like the environmental services. So this work is providing potentially crucial evidence that can inform the government's policies on how it decides on the level of need for funding from local government. And of course, with the current pandemic, that has made all these things much more stark, and this level of disinvestment from local government has potentially made particular communities more vulnerable to the current pandemic. Thank you.